Okay, let's talk about high blood pressure. You probably think you know the usual suspects, right? Diet, stress, maybe your genes. But what if I told you that for a surprising number of people, the real cause has nothing to do with their lifestyle? It's all about their hormones. And figuring that out, it can be the difference between managing a condition for life and finding an actual cure.
So let's start with a basic question. Do you think all high blood pressure is the same? You know, most of us probably do, but it turns out that's not the case at all. And for some people, understanding that difference isn't just a fun fact, it can literally change their life.
So this chart gives us the lay of the land. See that giant 90% slice? That's what doctors call primary, or essential, hypertension. It's the kind with no single clear cause. It's the one we all know. But look at that little 10% sliver. That is secondary hypertension. It's high blood pressure that's being caused by something else. And that 10%? Well, that's where our investigation begins.
An iceberg is really the perfect way to think about this. That massive 90% is the part everyone sees, the part above the water. But we're going scuba diving. We're going below the waterline to explore that hidden 10%, to find the very specific and often treatable causes that are lurking beneath the surface.
And our search is about to get even more focused. You see, within that 10% group, most cases are actually caused by things like kidney disease. Only a small fraction of that group, about 20%, is caused by the endocrine system, our body's hormone control center. It's a tiny target for sure, but finding it means everything for the people in that group.
So where exactly is this hormonal problem coming from? Well, our investigation leads us to these two tiny but incredibly powerful little organs, the adrenal glands. You can think of them as the hormone factory right at the center of our whole mystery. Just picture this. You've got two small triangular glands and each one sits right on top of a kidney, kind of like a little hat. They are not big at all, but don't let their size fool you. They are absolute powerhouses, churning out critical hormones that control our stress response, our metabolism, and, most importantly for us, our blood pressure.
Okay, quick anatomy lesson, because this is really important. The adrenal gland has two main parts. You've got the outer layer, the cortex, and it produces a hormone called aldosterone. Then you have the inner core, the medulla. It makes catecholamines, and you definitely know the most famous one, adrenaline. Keep those two zones and their hormones in mind because they are our two main suspects.
All right, let's open our first case file. The prime suspect is aldosterone. The condition is called Conn syndrome. This is actually the most common type of endocrine hypertension, and it all kicks off with an overload of this one hormone from the adrenal cortex.
So what exactly is Conn syndrome? Well, it's a condition where one of the adrenal glands just goes totally rogue and starts pumping out way too much aldosterone. And in most cases, the reason is a small, non-cancerous tumor called an adenoma that's just sitting there on the gland, causing all the trouble.
So how would a doctor even begin to suspect this? What are the clues? Well, we're not talking about slightly high blood pressure here. We're looking at severe cases, or blood pressure that just won't budge, even when someone is on 3 or more different medications. But the biggest, most telling clue is in the blood work, a low level of potassium. See, aldosterone's job is to tell the kidneys to hang on to sodium and get rid of potassium. So if your aldosterone is sky high, your potassium levels just plummet. That is a massive red flag.
Okay, so the clues are pointing in one direction. How do the investigators, the doctors, actually confirm their suspicions? How do they crack the case? It all comes down to one very clever blood test.
And here it is. This table basically shows us the smoking gun. Investigators measure two hormones, aldosterone and another one called renin. Now, normally, these two are in a feedback loop. Your kidneys release renin, which tells the adrenals to make aldosterone, but in Conn syndrome, you've got that tumor just pumping out aldosterone all on its own. The body sees all this aldosterone and tells the kidneys, hey, stop making renin. So you end up with this unmistakable combination, crazy high aldosterone and super low renin. That's the ballgame. And to really nail it down, doctors calculate what's called the aldosterone to renin ratio. When that ratio gets above 1,000, using some specific units of measurement, that's pretty much the final piece of the puzzle. It's the hard data that proves an adrenal tumor is the real culprit behind the patient's severe hypertension. Time for our second case file. This one is much rarer, a lot more dramatic, and it's hiding deep inside the adrenal gland, in that inner core, the medulla. We are now investigating something called a pheochromocytoma.
A pheo, as it's often called, is a rare tumor of the adrenal medulla. But this isn't like Conn's, with its slow and steady overproduction.
No, this tumor releases massive bursts of catecholamines. We're talking adrenaline and noradrenaline, triggering a sudden and completely overwhelming crisis in the body.
The clues for a PHIO are incredibly dramatic and classic. Doctors are trained to look for this specific triad of symptoms all happening at once: a sudden, explosive headache, just drenching sweats, and tachycardia, which means your heart is suddenly pounding, just racing out of control. It's like the body's fight-or-flight system has been hijacked and cranked up to 11. And listen to this description of what those episodes are like. The patient gets these paroxysms, or these sudden attacks. They may go pale, may start perspiring, get a panic attack. Think about that. It feels exactly like a terrifying panic attack. But the cause isn't in your head. It's a massive, uncontrolled surge of adrenaline coming from a hidden tumor.
So let's put our two culprits side by side. Conn syndrome, it's in the adrenal cortex, it's overproducing aldosterone, and it's more common. Pheochromocytoma, it's in the adrenal medulla, it's releasing huge bursts of catecholamines, and it's extremely rare. The key clue for one is often a quiet sign in your blood work, low potassium, while for the other, it's those terrifying dramatic episodes.
So we've looked at two very different, very hidden conditions. But that brings us to the most important question of all. Why does all this detective work matter so much?
Because this isn't just some fascinating medical puzzle. For the person going through this, getting the right diagnosis can mean the difference between a lifetime of managing symptoms with multiple pills and a potential cure, a complete fix.
This number says it all. For people with Conn syndrome caused by one of those little tumors, surgery can offer a cure up to 70% of the time. Let me say that again, a cure. No more high blood pressure, no more medication. That isn't just treatment, it's a resolution. That is a completely life-altering outcome.
So, let's wrap this up. What are the key takeaways here? First, and most important, not all high blood pressure is created equal. Second, there are specific clues that can point to these hidden, treatable causes. Third, conditions like Conn's and PHEO are rare, yes, but they are incredibly important to find. And finally, the big one. Getting the right diagnosis isn't just about better management. It can actually lead to a cure.
I think the big lesson here is that sometimes, if you just look a little deeper at a common problem, you don't just find a better treatment, you find an answer. Which leaves us with a pretty big question to think about. What other cures are out there, hiding in plain sight, just disguised as our most common diagnoses? Thanks so much for joining me.